So if you have a persistent problem in your knee, you might be eligible for a promising study that'll both treat and manage your case. Dr. Philip Jacobs is a board-certified orthopedic surgeon at the San Antonio Orthopedic Group, which, by the way, is the only site for the NeoCart clinical trial in all of Texas. Good morning, doctor.
Good morning.
So if you have problems in your knee, what particular problem are we talking about?
So what we're talking about is the articular cartilage in the knee. And I have a small knee model here that if you look at the model, you can see this blue would represent normal cartilage, which is usually a smooth surface. And here I've drawn a little circle which can represent a defect in the articular cartilage. So we're looking at treating the defect in the articular cartilage.
And when I'm looking at that model, it looks like it's inside, correct? Inside meaning in the inner part of the knee, correct?
More commonly, it is on the medial side or the inside portion of the knee. It can also happen on the outside or lateral side, but this is a more common location for a lesion or a defect.
What kind of problems for people who have that condition, what kind of problems are they experiencing?
So most patients will complain about locking and catching. They'll also have swelling in their knee. You can think if there's actually a defect in the articular cartilage here, that with motion like this, especially twisting and turning type motion, that's actually going to engage and it's going to cause pain in the knee.
Sounds painful.
Yes.
So sometimes athletes will experience this, correct? Maybe if you had a really terrible fall, you could experience this.
Yes, I mean, it's commonly associated with sports injuries or just injuries to the knee. Oftentimes we'll see that associated with a ligament injury in the knee as well. But it can happen just from wear and tear, but more commonly it is an injury.
Okay, so when folks hear about this, that you've got a clinical study, what usually goes on and what kind of participants are you looking for?
So what we're looking for right now is we're in a phase 3 portion of the study where we're comparing what we used to do, it was called a microfracture technique, where we actually would take holes and poke holes in the knee joint on that lesion, and those little holes would actually fill in with blood and form a fibrocartilage, and that cartilage isn't as sturdy as the cartilage that we're trying to represent with NeoCart. With NeoCart, we can take a similar lesion and we actually take cells from the patient's knee, we grow those cells, and then we're able to put, excuse me, the scaffold of those cells back into the defect. So we actually fill the defect with a scaffold and we can cut it to size so it actually fits the defect like a puzzle. And
we're going to look at a poster that you brought with you as well. Explain this to us.
So this is just representing what we were showing on the knee models, that there's actually normal cartilage on the outside portion of the knee. That white shiny part is normal cartilage, and then you can see where there's a defect, and that defect is representative of what we just showed on the inner part of the knee, and that's what we're trying to treat.
Okay, a much bigger illustration. So for anybody who's saying, you know what, I know I suffer from this type of injury, they can definitely participate in this study.
Absolutely. We're looking for people to participate in the study. We're in the phase 3 portion of the study. We're looking for patients that are between 18 and 55 years of age, non-smokers preferably, and basically if they have knee pain, they need to come in for an evaluation to see if they're a candidate for the study.
And how much time are we looking at?
As far as
spending some time with the study?
Yeah, so we're in the phase 3 portion of the study. Phase 2 actually showed that there was preferable results. So we're going to proceed with phase 3, and like I said, we're enrolling patients at this time.
I see. Okay. Well, thank you so much, doctor. Once again, NeoCart study. For more information, you can certainly give them a call. NeoCartimplant.com. Thank you so much, doctor.
Thank you.
Stay with us. We'll be right back.